given the latest numbers from Health Canada that they show that the BC and Nova Scotia are leading the country in increases in cases among young people, wondering why BC is not flat out requiring masks in classes and whether that will change.
Yeah, I'm not sure I see the connection between the young people in their 20s and 30s who we're seeing now contract the illness and wearing masks in classes. And I will say that none of the provinces have required masking of all students in classes. And there's very little evidence that that is a measure that's going to protect people. We know that there is a place for masks. They are the point, the end of our hierarchy of controls, the layers that we need, the least effective of the layers that we need. So I absolutely believe there's a role for masks in places in our school setting, particularly for teachers and administrators when they cannot maintain distances in particular. But we also know that masks can interfere with the ability to learn. So I think there's a lot more that we need to understand. But right now, the role of masks in our schools will be in those settings where we cannot maintain physical distancing within things like hallways sometimes and settings like that for older children. So that's what we will continue to do, and we'll continue to evaluate and reevaluate and learn as we go.
Do you have a follow-up, Ian?
Yeah, are you confident that youngsters will be able to sort of properly use masks in the chaos of the school system? Later on that, I know the BCTF is pushing for more masking in schools.
Yeah, so I think that's one of the things that we need to do right now is socialize the use of masks and help our children understand where and when they use them and how to use them properly. And that is something that I know young people in my life were working on, and it is a challenge. And certainly, to think of particularly a young child, 10, 11, 12, sitting all day in a classroom with the mask on is probably not realistic. There's lots of things that we can do to make those environments safe without requiring somebody to sit with a mask on for the long periods of time. So that's what we'll be looking at. We are looking, of course, to making sure that we're following all of the data on transmission in children and on use of masks in children, and we'll continue to adapt and to adjust as we go forward.
Just on this issue around masks, where do you believe that it will be appropriate in a school setting to have masks? And can you explain a little bit more? I've heard a lot of feedback since your comments last week around physical distancing in terms of what alterations can be made in the classroom, especially when there's fixed space and fixed desks that could allow for a semblance of physical distancing inside of a classroom.
Yeah, so there's lots of things that we know around how this virus is transmitted in those settings. So there's the way people are sitting, which way they're facing, whether they have distance between them, the types of activities you're doing. So every setting is different, but there are opportunities for schools to look at that. It obviously, it's reflected in numbers in classrooms. It's reflected in the ability to remove a lot of stuff that may be in classrooms, so minimizing the amount of other things that are in the classroom, furniture, etc. Looking at ventilation and how to improve ventilation. I think masking is really important in those situations where particularly adults are getting together, or older children are in situations where they can't maintain at least a meter distance. And those are the types of things that every school will have to look at. There is a role for masks, absolutely, but they are, as I've said, sort of one of the layers of protection that we have, and we're building in many layers. And I think there's been a lot of confusion about the term that we've been using of cohorts or learning groups, and the fact that some people believe that means they're going to have close contact with 60 people every day, which is not the concept at all. It's maximizing the number of people over the semester or the whole year that children will have contact with, and that includes all of the children and the staff in that sort of maximum number. So for most schools it'll be much smaller than that, but that does give ability to stagger groups of classes together, for example, so that you're able to stagger arrival times and resets and lunches and make it work on outside classes, for example. And we need to, there's lots of great ideas that I've been hearing both from teachers and principals and parents about how to do some really neat, innovative things that will help children. Things like having outdoor classes, like looking at how they can have safe interactions in smaller groups, socially distant or physically distanced. So I think there is a lot of learning that we can take from other countries on how they've done this safely. And I will also reflect that what happens in schools reflects what's happening in our communities. And that's why all of us have to pay attention to what we're doing to keep our communities safe. Where we've seen large outbreaks or numbers of both staff and students get sick in school settings, it's when there's been high numbers in the community as well. And so we need to do our bit over the next few weeks to make sure that our children, because of the importance of getting back into that in-classroom learning for a whole variety of reasons, that we're able to do that in every community here in BC.
Again, a return to masks in the classroom. The BCTF has expressed some concerns, regardless of confusion around the cohort model, that even the typical class size of 30 students or so would be very difficult to ensure any real sense of physical distancing between students. Some parents and teachers with that in the backs of their mind are talking to us about they would love to see masks mandated in a classroom situation. The Canadian Public Health Officer made recommendations around children 10 and up wearing masks. Children do go home at the end of the day to their family, some who may be immune compromised and whose parents perhaps work in the wider world. Is there not a role for masks in the classroom as an added layer of protection?
So as I've said several times, there is a role for masks, and there is absolutely permissive roles for children to wear masks. We know, though, that masks are the least effective part of our layers of protection, and we will be building all of those into our school system to make sure that we can have safe and effective education of our children in the best possible way, given that we're in a global pandemic. And what we are saying aligns completely with what Dr. Teresa Tam was saying, that it's recommended for older children in those situations where it's important. And I think we need to also remember where some physical distancing can't be said. She did not in any way say it should be mandated in any school situation. So we also have to remember, as I've said, that it's what happens in the school reflects what's happening in our community, and that's why it is so important for all of us, to continue to do what we need to do to prevent transmission of this virus, and for us in public health to keep doing what we are doing and in actively managing the cases. We know that this virus is circulating, and in young people, particularly in children, they can have very little symptoms, they can have very mild symptoms, so we need to be able to manage those effectively in every situation in our community. We're doing it through this summer with daycares and summer camps. We will continue to do it in schools to make sure that they're safe and that our children get what they need, which is so important.
Back to the school situation, some statistics up from the United States, I think it was today or yesterday, show a 40% increase in the number of COVID-19 infections amongst children, which is obviously quite high. Does that give you any pause for thought or re-examining what's going to be happening here?
Yeah, and this reflects, and I've read that study in some detail, and it does not surprise me. It concerns me immensely. I will also say that that's still very low numbers. So the percentage of children who are ill and who get this virus is still much less than their respective proportion in the population, and we see the same thing here. We'll be presenting some more information on that. But what it does is it reflects what I've been saying, that schools and transmission in school settings are a reflection of what's happening in your community. And we know that in many communities across the U.S., there is still very high levels of community transmission with thousands of cases a day in many communities. And when schools open without having safety measures in place, which we have seen in many communities, then they can become a place where transmission happens widely. Even in those situations, though, what we've seen is when the school identifies people, they identify people who are positive, they remove them from that situation. And there's a couple of examples in the state of Georgia, for example, where the schools have closed for a short period of time. They've isolated the contacts and then they've reopened. So it is something that reflects the challenges that are going on in communities across the U.S. and why I'm so insistent that the importance of education and the education system for supporting children, whether it's social supports, psychosocial supports, access to medical care, access to food, access to all kinds of supports in our classroom system, is dependent on all of us continuing to do what we're doing to keep our numbers low, to keep that transmission low, so that it is safe in all of our communities and we can open our schools and support our children.
If a student or a staff member tests positive for COVID-19 at school, can you elaborate on what the protocol will be for that learning group? Like, will everyone, say up to all 60 of them, have to go into isolation, or will they simply be told to monitor themselves for symptoms? And if we could get an answer in French as well on this, please. Thank you.
So again, this is the work that we do every day. We did it in June, where we had a couple of staff in several schools test positive. So it will depend on the situation. So it depends on when and where. If it happened when they had not been in school during an infectious period, then no, there might not need to be anybody who's self-isolating. If it happened where there was exposures to many other children, so an assessment, a risk assessment is done, and a case investigation is done by public health. And I will remind everybody that we do have school health officers, and that's the medical officers of health across the province for every school, and we're used to working with the school community around infectious diseases and other concerns in the school setting. So we do everything from nutrition and sports and physical activity to managing infectious diseases. So there will be an investigation of every single case, and then anybody who is at risk will be removed from the environment and self-isolating. So the worst case scenario would be that 60 group of people would be asked to self-isolate, be required to self-isolate. And we need to have some flexibility in case something like that happens. But it's much more likely that the unit of learning is still going to be classroom-based, and those will be smaller units. So it's still in the classroom. So the most likely transmission is going to be in a much smaller group of people, if that happens, or the risk of transmission is in a much smaller group of people. So each of those will be investigated individually.